Hi everybody, Dr. Muse here at CCRC, and in this video I'm going to talk about something called fascial manipulation. If you look through the rest of our channel, you're going to find some other soft tissue techniques that we've spoken about, which may be addressing things like trigger points, excessive tone and tension in the tissue. Fascial manipulation is going after a specific kind of tissue that runs through the body called the fascia. And the fascia is something, just think of it as a all-encompassing tissue that envelopes all of the muscles, all the organs of the body, but it also invests itself into those structures. Now, we can develop things called densifications. Densifications is where an area of that fascia kind of gets bound up and it loses its ability to track the muscles and allow them to perform their actions how they should. So in this video, I'm going to talk about the fascia of the anterior thigh, or the front of the thigh. Now, we look for areas called centers of coordination. That's where a bunch of different muscles come into it. So if I find my way halfway up his thigh and kind of feel around, I may find some areas where maybe that tissue just doesn't slide and glide as well as I would like. And in those areas, those dense areas, that can then change how these muscles function, affecting the joint that they feed into. So when I perform fascial manipulation, what we need to occur to change that densification and restore its properties is we need heat and we need friction. So the answer to that is, once I find that center of coordination where it's densified, I'm just going to use things like my knuckle, I could use my elbow to apply friction and a little bit of heat over time to that area. We're trying to heat up that tissue. Now, fascial manipulation may not be the most comfortable treatment, especially if we're in the right area, but it still should be somewhat tolerable to the patient. I'm not just going to dig in there for the sake of creating pain, but we may sit here for, it could be a minute, it could be 2 minutes, until I feel that tissue release. Something that you may expect with fascial manipulation is, after we do the treatment, you may be a little bit sore for a few hours afterwards. Answer to that is go move around, go stretch. But the hope, like I mentioned, is to, for lack of better terms, de-densify that densification so that then we can restore proper function to the area being treated.